Hi viewers, today I'll be talking to you about menopause, everything about menopause. So what is menopause? Why do women get menopause? And is there an equivalent in men? Number two, why menopause happens? And what are the symptoms of menopause? What does a woman feel when they are about to enter menopause or already menopause has occurred? Third and fourth important things are basically how does one go about treating menopause? Is there any treatment for menopause that can be given by endocrinologist, and what are the benefits of these treatments, and what is the potential risk? What will happen if the treatment is taken, and are there any side effect of the medications that are used to treat menopause? All these aspects I'll cover in this video. You can look at the description and skip to the relevant portions of this video as well. And we'll also feature a lot of shorts, and you can hit the bell icon to subscribe to our YouTube channel. And we will be producing a lot of content related to diabetes and endocrinology over the coming weeks and months. And happy viewing. So when it comes to menopause is a physiological condition. Physiological condition means every woman has to enter menopause. So menopause occurs when all the eggs are over in the ovary. So every woman is born with a fixed complement of eggs that are used in the reproduction. And unlike men who keep on producing sperms throughout their lifespan, so this fixed quantity of eggs will undergo attrition as the age progresses. So usually a woman will have a reproductive lifespan from say 13-14 years of age. So from the time of menarche, reproductive potential is there, and reproductive potential is there up to maybe 50 years. So between 40 and 50 years of age, the menstrual cycles of a woman will stop. So the first anniversary of the last menstrual cycle is considered menopause. So that's the definition of menopause. So if 1 year is over after the last menstrual cycle and there have been no further menstrual cycle, so menopause is said to have occurred. So though this is the definition, so people will start getting symptoms of menopause maybe a few years even before menopause actually occurs. So for example, women will start feeling hot flushes or sweating and extreme body heat that occurs due to a deficiency of estrogen. So as the menopause occurs, the estrogen starts falling maybe not weeks, not months, few years even before menopause actually occurs. And because of estrogen deficiency, there can be episodes of hot flushes. These hot flushes will come on every 70 or 80 minutes like that in a periodic fashion. There is extreme amount of sweating and feeling of heat, and women may feel the need to stay under a fan or be under air conditioning. So this is a disconcerting symptom. Other than this, certain other symptoms are also there. Loss of libido or reduced interest in sexual activity can be there, and there can be vaginal dryness also. Vaginal dryness and difficult intercourse can be there. This is another symptom of menopause. And especially older women who are already menopausal, say in their 60s and 70s, they may have difficulty while passing urine. They may feel there is burning sensation while they pass urine. This is because of urethral atrophy. Because the estrogen becomes deficient, and the estrogen is required for maintaining the normal urinary tract in women also. Because of prolonged estrogen deficiency, see, menopause occurs at around 50 years, and up to 60-65 years there is no estrogen, because then the urethra undergoes atrophy, and due to that older women may find it difficulties while passing urine, some irritation, burning sensation while they pass urine. This is called the urethral syndrome, which occurs in older women who are menopausal. So these are some of the symptoms of menopause. But the most dangerous consequence of menopause is a loss of bone mass that women can face. So many women have got good bone mass, and osteoporosis or fractures would occur very late in life, basically. So typically menopause does not trigger immediate osteoporosis in majority of patients. But in select patients where the bone mass is low at the time of menopause itself, say by the time 45-50 years, if somebody is entering menopause and the bone mass is already low at that point, rapid reduction in bone mass and fractures could occur even in the 50s and 60s. Very early on, fractures could occur. So typically old age is the cause for osteoporosis, but menopause also can be a risk factor for osteoporosis in those who are already having a low bone mass. So for example, if your weight is low, if if you have a family history of fractures, and if you are menopausal, you need to reach out to your endocrinologist to assess your risk of fractures. We can actually get a bone mineral density little earlier than usual. Usually we get a bone mineral density for all women at the age of 65. You can get a bone mineral density done a little earlier if you are having early menopause, right? So coming to the how to diagnose menopause in the presence of certain symptoms. So we do a test called FSH, or follicle stimulating hormone. So when someone has not had a cycle for 3 to 6 months, menopause is always a consideration. Even in women who are in their 30s and not even yet 40, early menopause could occur, or this is a pathological condition. Usually menopause occurs between 40 and 50 years of age, but if you have a early menopause, this is pathological. It could be due to some genetic mutations, it could be due to autoimmune disease. So it's not uncommon to find women in their 20s also sometimes reaching menopause. So if you've not had cycles for many months, so typically doing a FSH will help us reach a diagnosis of menopause. If the FSH is more than 50 on more than one occasion, say twice, then we will strongly suspect that menopause has already occurred. So in these situations where menopause has occurred early, or there is a premature menopause, there is a need to find out the cause for the menopause, what has happened. So we run some genetic tests. We test for anti-ovarian antibodies, which can cause, the ovarian antibodies can cause early menopause. So we look for all these conditions in the situation of premature menopause. So when it comes to treatment, so what are all treatment options are there for menopause, and do we need to treat every woman with menopause? The answer is that there is no need to treat every woman with menopause. So menopause being a physiological condition, or it's a natural progression. So if the symptoms are not very severe and symptoms are tolerable, so just a reassurance is sufficient in majority of women. But some women who have extreme hot flushes, they have a lot of sweating, they are not able to do their day-to-day activities. For example, they are not able to go to their work, or they are not able to go, they are avoiding social engagements because of the heavy sweating that happens, or they are distressed by it. So we can definitely offer a combination of estrogen and progestin. So this combination is very, very effective in reducing menopausal hot flushes. Almost 90-95% of women who take this will get immediate relief from these hot flushes. Immediate means within a few days or even a week they start getting relief, and they do well when they are on this therapy. This is called menopausal hormone therapy, or MHT. So menopausal hormone therapy is not indicated for everyone. It's indicated for those who are having severe symptoms of menopause, not just all women with menopause. So earlier approach was to give menopausal hormone therapy to everyone who has reached menopause. So that strategy was not found to be very beneficial, because it was associated with slightly higher risk of heart attacks and strokes in women who received this treatment actually. So if you give to every woman without regard to symptoms, it's not beneficial. But if you give it to only those women who are having symptoms for a shorter duration, and especially early on in menopause, say for example somebody is just 48-49 years and having menopause, and if you are offering therapy, then it is very beneficial to the patient. And when it is given for a shorter duration, say 6 months or 1 year, there is no risk, and we don't need to screen for any complications due to the menopausal hormone therapy. When it comes to therapy before 40 years, there is no bar on therapy. So someone who has reached a pathological menopause, say due to surgery, someone has had say SLE and has received cyclophosphamide. Because of this agent, the ovary has stopped functioning, so or has received radiotherapy for leukemia, or has taken some other treatment which has stopped the ovarian function. So in these situations, we can actually offer menopausal hormone therapy. Even in potential cancer patients or autoimmune disease patients, we can actually offer hormone therapy patient. Definitely, we can offer hormone therapy to women who are undergoing premature ovarian insufficiency, POI, which is due to autoimmune disease or due to genetic conditions. So if you are less than 40 years of age and if you already had menopause for some reason, make sure that you're on hormone therapy at least up until the age of 45, because it will make sure that your bone strength is maintained, and it makes sure that you're at a lower cardiovascular risk than you will be without treatment. So definitely there is a benefit for women below 40 years of age who are undergoing early menopause. So the risk-benefit ratio is different for different age groups. In very older women, routine replacement and routine hormone therapy may not be beneficial, and there may be a slightly higher risk of cardiovascular events. In women who are just menopausal with a lot of hot flushes and symptoms due to menopause, there is clearly a benefit and the risk is very minimal. And in women who have undergone menopause early, say below 40 years of age, there is definitely a benefit and the risks are very, very minimal. And definitely these women should be on hormone therapy. So like this, there is a spectrum of risk-benefit trade-offs which we see in menopausal patients. And oftentimes when you're discussing your hormonal problems, say menopause is there, so many people will give generic advice saying that hormone therapy is bad for you or hormone therapy is good for you. So we need to make a qualified decision based on your life stage. What is the cause for your menopause? Is it a natural one? How old you are? All these things have to be taken into account when deciding when you have menopause. And of course, for menopausal hot flushes, there are other treatments like venlafaxine also available. Venlafaxine is a SNRI or a serotonin norepinephrine reuptake inhibitor. It acts on the brain and reduces the chances of hot flushes actually. So women do get relief from this. And apart from estrogen and SNRI, a lot of women do take phytoestrogens. So phytoestrogens are not well characterized actually, they are not well studied, though these also provide some benefit from menopausal hot flushes basically. So, but as endocrinologists, we don't prescribe phytoestrogens because they are not evidence-based medicines, and the risk-benefit trade-off with these agents, we are not really aware regarding whether there are any risks associated with phytoestrogen therapy. So, so we need to look at all these aspects and then take treatment for menopause. I hope this video was useful to you and you could understand some aspects of menopause, why it occurs, how we diagnose it, and how we treat. Thank you.